And breast implants, all words that are becoming common in teen vocabulary.
More and more teens are thinking about going under the knife for plastic surgery. Allison Gardner joins us now with more in this special report. Allison?
Rick and Vicki, health experts say interest in teen plastic surgery has actually increased by about 20%. The question is why, and is it safe? Some experts say teenage rock stars like Britney Spears and Christina Aguilera, who are built like women in their mid-20s, may be responsible. But there are some things all teenagers should consider before they decide to get pretty in plastic.
Britney Spears had her breast done and everything, but I wouldn't want to.
This blonde bombshell is causing quite a stir. It's not all about her music, it's also about her body. There are rumors the 18-year-old singer has breast implants. Spears denies it, but if you ask your teenagers, they probably know someone in their school that has gone under the knife.
I don't think I'd be interested in, but I know a lot of people who've done it already as teenagers. The girl on my soccer team just had a nose job.
So how did teens get so hip to plastic surgery?
Well, everybody watches TV and reads magazines.
Plastic surgeons say more parents are getting plastic surgery, and teenagers pick up a lot of ideas from mom and dad.
I think that teenage population mirrors the adult population.
And experts say teens are surrounded by perfect images like these all the time. The perfect body is featured on page after page in teen magazines.
Well, I guess there's like pressure on people, you know, like to look their best and everything, and like girls especially to look really good.
Plastic surgeon Dr. Brad Calabrese says it's normal for teenagers to worry about their appearance, but if your 12-year-old daughter is talking about liposuction, there could be a problem.
Don't we all want to believe that, especially our children, are feeling satisfied and are feeling good about themselves? And you start wondering, as you think about cosmetic surgery for a teenager as being almost a desperate measure of something to do to make them fit in.
In fact, Dr. Calabrese says a physical defect is the only reason he would operate on teenagers.
Especially if a female has developed a fully developed breast on one side and hasn't developed a breast on the other side, and there's a lot of asymmetry or unevenness. Well, I think in that situation you may want to start earlier and do some cosmetic procedures, almost reconstructive procedures.
The bottom line, the experts say, talk to your kids about their bodies and about the dangers of getting pretty in plastic.
I don't know, I just don't really believe in it. I wouldn't really want to change myself like artificially.
If your child is thinking about plastic surgery, here are some guidelines to keep in mind. Assess your child's physical maturity as well as their emotional maturity. You should also check your surgeon's credentials and look into risk and expected recovery times. Now, plastic surgeons want to point out, Rick and Vicki, that even though teen interest in plastic surgery is on the rise, teens only comprised about 3% of last year's procedures.
Most teens don't even like to get shots, much less undergo surgery.
It's amazing, and like Dr. Calabrese said, if your 11-year-old is talking about liposuction or breast implants, there may be a more serious problem that you need to look into.
All right, thanks, Allison.